Good morning, students. In continuation of the chapter Physical Education and Sports for Divyang, today we will talk about the obsessive compulsive disorder. Obsessive compulsive disorder, its short form is OCD. So, generally, the question comes that what do you mean by OCD? Obsessive compulsive disorder. It is unwanted and repeated thoughts, feelings, ideas, sensations, and behaviors which can drive ourselves to repeat some certain task. Obsessive compulsive disorder is defined as a mental disorder in which people have unwanted and repeated thoughts comes in the mind, and on the basis of that thoughts they repeat the any kind of work or action. OCD is a common, chronic and long-lasting disorder. Simply uncontrollable thought comes in the mind and they feel the urge to repeat over and over any kind of skill or rituals. It is a disorder in which people feel to check things repeatedly. Obsessive thoughts can include fear of germs are getting dirty. It happens that the person can feel it that the germs are coming in his or her hand and he is getting dirty. Worries about getting hurt or other being hurt. Obsessive thoughts can include need for things to be placed in an exact order. Believe that certain numbers of color are good or bad. So they may have the superstitions in the mind. Constant awareness of blinking, breathing, or other body conscious. Compulsive habits can include, so what kind of habits they can have? The person can have the urge to washing hands many times in a row, doing tasks in a specific order every time, respective checking on a lock, door, light, switch, and other things. Need to count things like steps or bottles. Putting items in an exact order like cans with labels facing front. Fear of touching brook knobs, using public toilets, or shaking hands. Constant praying or hoarding things. So these were the habits a compulsive obsessive compulsive disorder victim can have it. Causes of OCD. The exact cause of OCD have not been identified. It is thought to have a neurobiological basic, which studies showing that the brain functions differently in people with this disorder. Imbalance in Transmitters is also thought to be involved in OCD. OCD may be a result of change in our body own natural chemistry or brain functions. It may also have the family history. Genetically, OCD may have a genetic components, but specific genes are yet to be identified. Factors that may increase the risk of developing or triggering obsessive compulsive disorder includes family history, stressful life events, and so on. So these were the obsessive thoughts and compulsive habits and few causes which we have learned. We can manage this obsessive compulsive disorder treatment. Obsessive compulsive disorder treatment may not result in permanent cure, but it can help bring the symptoms under control so that they help normalize daily life. Some people need treatment for the whole life. The two main treatments for OCD are psychotherapy and medication. Cognitive behavioral therapy, CBT, a type of psychotherapy, is effective for many people with OCD. Exposure and response prevention, ERP, a type of CBT therapy, includes gradually exposing the sufferer to a feared object or obsession. In medication, certain amount of psychiatric medications can help control the obsessive compulsive disorder. Most commonly, antidepressants are tried first. Sometimes medication and psychotherapy are not effective enough to control OCD symptoms. Research continues on the potential effectiveness of deep brain stimulation (DBS) for treating OCD that does not respond to traditional treatment or approaches. Now we will talk about the disability etiquettes. My dear students, as we know that disabled are the persons who needs more care and support from us. So what kind of etiquettes or manners we should maintain in front of the disabilities? Disability persons. Disability etiquettes are a set of guidelines dealing specifically with how to approach a person with disability. Basic disability etiquettes involves treating disabled people with respect. Practicing disability etiquettes is an easy way to make a disabled person feel welcome. We don't have to feel awkward while dealing with a person with a disability. People with disabilities are individuals with different needs, and many of them are totally independent. We need to appreciate the fact that being disabled is not a choice but a chance, and these people deserve a much respect, if not more, as those who are normal. Asking for the help. Whenever we reach to the disabled person, we should always try to ask what kind of help he needs or she needs. Treat them according to the age group, as we know that we can find different age groups disabled, so we should not think it that same behavior will be made by us with each and every age group person. We should have a different behaviors with them. Call a person by their names if you are known to him. Directly we should not call the name. If we are very close, then only we should call the names. Avoid patting on the head. If the person is sitting on the wheelchair, we should not pat on the head of the person. Don't clean your hand on someone's wheelchair. The clean, not lean. Don't lean your hand on someone's wheelchair. We should not be leaning on anyone. Ask for the permission before touching someone's wheelchair. My dear students, we should always mind it that suppose someone is sitting on the wheelchair, directly we should not touch the wheelchair or equipment which the person is using. It may bring him or her to an accident. Always introduce yourself before starting the conversation. Suppose the person is blind. Suppose we have started some kind of talk and he is not knowing me and you, then definitely he or she will feel some kind of problem to explain that things. So, first of all, we should say that I am this person and I have come here to talk with you. Don't shout. Write notes may also help. Suppose the person is not able to listen and see, then we should speak something, but this person is not listening anything, can see only, then definitely we should write something on a piece of paper and he can read it. Speak very slowly and politely. Our voice should be very mild while talking with anyone. Small words and sentences must be used. Instead of speaking a long statement, we should use a very small statement or a small words. Listen very carefully and attentively. Whenever the victim is speaking something, that time we should always try to speak very politely. And suppose the person is speaking something, we should listen very smartly. Don't speak very fast. Don't correct them, instead, encourage them. Always, this is the instruction which we should follow, that if any mistake is done by the disabled person, directly we should not correct them. We should say, yes, you are doing good, but need a kind of improvement in it. So, my dear students, finally, we are going to complete this discussion, and I hope that you will be benefited with this. Till then, goodbye. Thanks.